medical flower. Some governments embrace it, others restrict it. But why? In this long-form episode, Budfellas explores the story of medical cannabis, its history, benefits, science, and the reasons governments allow its use in society. We'll go deep into culture, law, and patient perspectives. Remember, this video is for educational purposes only. Check the guidelines and laws in your country or region. The roots of medical cannabis go back thousands of years. Ancient texts from China in 2700 BCE describe its use for pain and rheumatism. In Egypt, records show it was applied for inflammation and eye conditions. In India, it became part of Ayurvedic healing, tied to both medicine and spirituality. Greek and Roman physicians later experimented with the plant for digestive issues and wound healing. Fast forward to the 19th century, when cannabis tinctures were available in Western pharmacies. Doctors prescribed them for insomnia, headaches, and stomach problems. By the 20th century, prohibition and international treaties limited this use, branding cannabis as dangerous. But by the 1990s, the tide began to turn. California legalized medical cannabis in 1996, and Canada followed in 2001. Today, dozens of countries regulate medical cannabis in some form. Medical cannabis is not a cure-all, but research shows significant benefits. Chronic pain relief. Patients with arthritis, cancer pain, or spinal injuries often turn to medical cannabis when conventional drugs fail. Chemotherapy-induced nausea. Cannabis-derived medicines help patients tolerate life-saving treatment. Multiple sclerosis, spasticity, and muscle spasms can be reduced. Epilepsy. Certain cannabis-derived medicines are approved for severe childhood epilepsy syndromes. Mental health. Early studies suggest benefits for PTSD and anxiety, though evidence is still being gathered. Most striking is opioid reduction. Some studies show patients lower their opioid doses or stop altogether when medical cannabis is available. Governments weigh risks against benefits. Allowing medical flower means regulating safety, quality, and access. Without regulation, patients might turn to unsafe black market products. Economic incentives matter too. Regulated industries create tax revenue and jobs. Countries differ. Germany reimburses medical cannabis under insurance. Canada has a federal system. The US has state programs but federal prohibition. And the UK allows prescriptions but in very limited cases. Why does medical cannabis work? The answer lies in the endocannabinoid system. This network of receptors regulates mood, appetite, pain, and sleep. Cannabinoids like THC and CBD mimic or influence natural endocannabinoids, leading to therapeutic effects. THC may reduce pain and nausea. CBD calms seizures and inflammation. Dozens of other cannabinoids and terpenes add complexity, the so-called entourage effect. Science is still exploring these interactions, which explains why some governments allow use cautiously, demanding more evidence. Behind the policies are people. Patients with chronic illnesses often describe medical cannabis as life-changing. A cancer patient who finally regained appetite, a veteran with PTSD sleeping through the night, a child with epilepsy experiencing fewer seizures thanks to cannabis-derived medicine. These stories fuel public demand and influence government decisions. The societal impact of medical cannabis is significant. Legal access reduces stigma, making it easier for patients to discuss openly with doctors. It undermines illegal supply chains, shifting revenue into the legal economy. It may also reduce healthcare costs by replacing or reducing expensive pharmaceuticals and lowering overdose risk. Challenges remain. Stigma persists, with some doctors reluctant to prescribe. Costs can be high, and insurance coverage inconsistent. Not all evidence is conclusive. Some studies show mixed results, and risks like dependency and mental health side effects are real. Globally, access remains uneven, with many countries tied to outdated drug treaties. Looking around the world, in Israel, medical cannabis research is advanced, with large patient programs. In Australia, patients need specialist approval, but access is growing. In Latin America, countries like Uruguay and Colombia allow cultivation and distribution under medical frameworks. Each country adapts based on culture, politics, and healthcare priorities. What does the future hold? As more research emerges, governments may expand access. Pharmaceutical companies are developing cannabinoid-based medicines. Public opinion is shifting in favor of patient rights. At the same time, debates over regulation, commercialization, and social justice will continue. So why do governments allow medical cannabis? Because the potential benefits, relief for patients, economic opportunity, and safer regulation, outweigh the risks. The story is still being written, with science, society, and law evolving together. What do you think? Should more countries allow medical cannabis programs? Share your thoughts in the comments. Don't forget to like, subscribe, and share this video if you enjoyed this deep dive.